Isang mapagpalayang araw sa lahat. Ako si Vanji Bernardo Daquilania, batch 89, gumraduate ng 1983. I will always be forever grateful to ILS for providing me the best home in UP. It has taught me to be resourceful, to always have a growth mindset, and it has honed my critical thinking skills. So, tipong saan area kaya sa main life masarap matulog? Na hindi ako may istorbo, lalo na kung may hangover. So you see, it has taught me really well. Of course, I'm also thankful for the lifelong friendship that has been forged throughout the years. Mga mabuting kaibigan, pati na din yung mga dating kaibigan. Happy 60th anniversary. Let's continue to be relevant and always be attuned with the times.
Hello, good day, and welcome to the March 2021 edition of the UP SLIS webinar series. We welcome our viewers, students and teachers of Library and Information Science, information professionals, and our friends and fans from the Philippines and across the globe. I am Paul Jason Perez, a faculty member of the UP School of Library and Information Studies, your host and moderator for this webinar. Before we proceed, please take note that our webinar is in high definition or HD. For an optimal viewing experience, please check and adjust the settings of this live stream to HD. You may also take the opportunity to check the audio and adjust the volume to a comfortable listening level. This webinar can be seen live on both our YouTube channel and on our Facebook page, UPSLIS. So, in the event that you encounter any issues on watching us live on Facebook, you may also watch this webinar at YouTube via UPSLIS channel. This webinar is part of the hashtag Webinar Wednesday, a series of monthly webinar offerings of the UP School of Library and Information Studies, as we count down to our 60th anniversary this July 2021. That's just a few months away. We're excited for the upcoming activities we'll be rolling out, and I hope that you are too. Definitely, this webinar will be another fruitful learning experience for us all. But before we proceed, please allow me to explain the mechanics of this webinar. If you have any questions during the lecture, you may post your questions by going to www.menti.com and typing in the code 2555903. All questions will be tackled in a question and answer portion after the speaker has presented. Please take note that we will not be entertaining questions posted in the comment section of this video. Again, you may post your question by going to menti.com and typing in the code 2555903. The website and code will be shown on screen throughout the talk. Alternatively, you could use the QR code also shown on the screen to go to the questions page. At menti.com, you may view the questions posted by our other viewers. If a question you wish to ask has already been posted, please upvote the question by clicking its thumbs up icon so we can prioritize and address it first. We will be issuing certificates of participation to those who will be joining us in the live event. We ask that you finish the webinar and watch out for the announcement containing the link where you can register for your certificate. As part of the requirements for the certificate, you need to answer a question correctly. We advise that you listen intently to the speaker during the talk. If you answer incorrectly, you can rewatch the video and try again. For registered professionals, this webinar may be applied for continuing professional development or CPD as a self-directed learning activity. Again, please stay with us until the end of the webinar for instructions on how to get your certificate. If in case you miss portions of this webinar, you may view this as a Facebook video or check our YouTube channel at UP SLIS. It is now almost a year since the pandemic has changed and affected our lives. We had been through very dark days, but it seems that we are seeing the end with the vaccines being rolled out in many countries. However, the fight against misinformation and disinformation continues. We, as members of the library and information science profession, can lead in the responsible dissemination of information, especially health information. This afternoon, we're very lucky to have an expert in medical librarianship to talk about consumer health information service. Our speaker is Mrs. Joenabie Arevalo. She's the librarian of the Ateneo de Manila University School of Medicine and Public Health. She also teaches medical and health librarianship electives in the graduate level at the UP School of Library and Information Studies, where she also obtained her bachelor's degree cum laude in 2004 and a master's degree in 2011 in library and information science. She got her license in 2004 and ranked fifth in the licensure examination for librarians conducted by the Professional Regulatory Board for Librarians and the Professional Regulation Commission. She served as the president of the Medical and Health Librarians Association of the Philippines, or MALAP, from 2014 to 2016. She was a member of the MALAP Board of Trustees since 2008 and advisor to the MALAP Board of Trustees from 2020 to 2021. She contributed research papers in refereed journals, delivered paper presentations, and chaired and co-chaired several technical sessions in both national and international conferences. Through MALAP, she helped organize various seminars, conferences, and workshops. Her interests are medical and health librarianship, medical e-resources, and data curation. Ladies and gentlemen, let us all welcome Mrs. Joenabie Arevalo. Hi, Mom Jonah. Now, on with Miss Jonah's lecture. Happy learning to us all.
Huwag mahihiyang magtanong. May RightMed info pa dito. A lecture on Consumer Health Information Service, Responsible Dissemination of Health Information in Libraries. Magandang araw po sa inyong lahat. Maraming salamat po sa UPSLIS, kay Ma'am Rhea at kay Sir Mark sa paanyaya at pagkakataong makapagbahagi sa inyo ngayon. Ako po si Joenabie E. Arevalo, librarian ng Ateneo de Manila University, School of Medicine and Public Health.
Before we proceed with discussing consumer health information, magandang maunawaan muna kung ano ang ibig sabihin ng health literacy at health information literacy. Then we will discuss what is consumer health information and responsible dissemination of health information in libraries. In this time of pandemic, good health literacy has never been more crucial. Health literacy is important because at some point in our lives, we all need to be able to find, understand, and use health information and services. Taking care of our health is part of our day-to-day life, not just when we visit a doctor, clinic, or hospital. Health literacy can help us prevent health problems and protect our health, as well as better manage those problems and unexpected situations that happen. Even people who can count and read well can face health literacy issues, especially when they are not familiar with medical terms or how their bodies work. When they have to evaluate risks and benefits that affect their health, or when they are diagnosed with a serious illness and are scared and confused. or when they have health conditions that require complicated self-care. Pareho ba ang limited health literacy and limited literacy? Hindi po. But they are related. People's reading, writing, and number skills are only part of health literacy. People do need strong literacy and numeracy skills to make it easier to understand and use health information and services. But research shows that many health and healthcare activities are unfamiliar, complicated, and technical to most people. According to WHO, health literacy is the personal characteristics and social resources needed for individuals and communities to access, understand, appraise, and use information and services to make decisions about health. Here's another definition of health literacy. According to the Canadian Expert Panel on Health Literacy is about making informed decisions and taking actions to promote and protect health. Health literacy is the degree to which individuals are able to access, understand, evaluate, and communicate information to engage with the demands of different health contexts in order to promote and maintain good health across the life course. Research shows that health literate patients are more able to make healthy lifestyle choices, have better communication and interaction with healthcare providers, access information and services, manage chronic diseases, and engage with health education and promotion. Health literacy is also a way to promote, maintain, and improve health across the life course. And health literate partners consider the role of health literacy in helping patients access, understand, evaluate, and communicate information resulting in increased effectiveness in treating patients, better patient relationships and communication, and increased efficiency in the entire healthcare system, both public and private. The 2019 PMA President Dr. Jose P. Santiago Jr. emphasized the importance of health information literacy. During the 2019 PMA Annual Convention, he said, "What is the use of hospitals and clinics and an abundance of doctors, nurses, and other medical personnel if the population is not informed or literate enough to understand how to make use of them?" Low health literacy is linked to poor health outcomes such as higher rates of hospitalization and less frequent use of preventive services. According to Dr. Santiago, the approach to health literacy involves first, preventive and promotive, and second, curative and rehabilitative. These are the important pieces of information that must be planted in the hearts and minds of the community. As information professionals, we can take part in the first approach. We can get involved in the awareness campaign about proper hygiene and sanitation and a healthy lifestyle. The basics such as washing of hands, observing cleanliness, using clean water, and eating the right food are all meant to prevent getting ill. Immunization is part of the preventive aspect of care. It is best that we only share credible information about vaccines or other health-related information for that matter. Since we're on the topic of sharing credible information, let us try this activity. It is called fact or bluff. If the information is true, answer fact. If it's false, answer bluff. Are you ready? For statement number 1, chocolate causes acne. Is it a fact or is it a bluff? It's a bluff. Despite decades of research, there has been little proof that single food like chocolate directly causes acne. But that doesn't mean that diet has no influence. Next, sleeping with wet hair causes mental disorders. What do you think? It's a bluff. Mental disorders are not caused by sleeping with wet hair. A number of factors can contribute to risk for mental illness, such as genes and family history, life experiences such as stress or a history of abuse, especially if they happen in childhood, biological factors such as chemical imbalances in the brain, a traumatic brain injury, and others. Next, being obese shortens your life expectancy. It's a fact. A 2018 study published in the European Heart Journal looked at the body mass index or BMI of more than 300 people. Researchers found that the risks of heart attacks, stroke, and high blood pressure increased as the BMI increased. In an earlier study published by JAMA Cardiology, researchers found that overweight and obese people had a greater risk of cardiovascular disease, and obese people had a shorter lifespan than normal weight adults. So did you get all the answers correctly? I'm sure you did. Now let's go back to the second approach to health literacy. The second approach has to do with getting professional medical advice and support once it becomes apparent that the illness has set in. For information professionals, it is best that we refer our clients to medical practitioners, even though we know where to look for the correct information about a certain illness or disease or a particular drug or treatment. We should direct our user to the correct information and direct them to go to the medical professionals who can give them sound professional advice. We should refrain from interpreting medical information and must keep our personal opinions to ourselves. In 2008, the mesh term consumer health information was introduced. Consumer health information is intended for potential or current users of medical information. So that's all of us. It is designed to be educational and can help individuals make decisions about health-related behavior and medical treatments. It differs from clinical information, that is information written by and for medical professionals, because consumer health information is developed with the layperson in mind, less technical language, and a more user-friendly format. Consumer health information may include resources about prevention rather than cure, more about self-care and wellness, diseases and conditions, and sometimes about treatment, healthcare options, and more. In other countries, there is a specialized position called consumer health librarians. Their duties involve selection, evaluation, and provision of consumer health information. The role of the consumer health librarian is a bit complex. It may include assessing individual information needs, searching for relevant and reliable information sources, acquiring these resources, and delivering the information in a format easily understood by the library patrons. Consumer health librarians can be found in hospital libraries, where they might also serve in a dual role as clinical medical librarians, assisting physicians, nurses, and medical staff with clinical medical research articles and information. They can also be found in patient resource centers, freestanding health resource agencies, academic and public libraries. They are often medical librarians with a focus on consumer health, but can also be librarians trained for other settings, including academic, public, or special libraries. These institutions may be maintained by businesses, associations, non-profit entities, or government agencies to collect materials and provide information of special relevance to the work of the organization. and of course with consumer health as subject specialty. In the United States, the Medical Library Association offers a training for librarians on Consumer Health Information Specialization or CHIS. This is intended for medical librarians, public librarians, librarians working in consumer health libraries, allied health professionals, information professionals, and anyone who cares about providing accurate and useful health information to the public. The requirement to earn CHIS is organized around 8 core competencies for providing consumer health information services and 2 levels of accomplishment. Level 1 CHIS requires coursework in competencies 1 to 5. These are knowledge of the community, knowledge of the health consumer, knowledge of the subject matter and resources, evaluation of health information, and communication, health reference, and instruction. And Level 2 CHIS requires coursework in all 8 competencies. So that's including literacy and health literacy, technology and health, ethical and legal issues. So let's discuss the competencies in details. The first competency involves knowing the characteristics of the community served by the library, including demographics, special populations, health status indicators, and needs of community members. Librarians must understand that beliefs, customs, and values of different cultures can influence thoughts and actions around health, illness, and healthcare decisions. Librarians must be respectful and responsive to all user groups. Practice cultural humility through self-reflection and awareness that one's own beliefs and experiences can impact interactions with others. Be open to learning about the experiences and cultural identity of others as a lifelong endeavor. The second competency requires understanding the principles and practices related to providing appropriate relevant information services to meet the needs of different types of users, including patients, caregivers, educators, students, and health practitioners. Librarians must understand and respond to the issues and barriers faced by health information seekers. The third competency requires the understanding that the solid knowledge of specific resources for general and specific health topics is essential, as well as resources for specific population groups or for users with special needs. Librarians must know the library's print collection, both circulating and reference materials. Librarians must be well-versed in library subscription databases, including the coverage of materials, currency, and appropriateness for specific requests. Librarians must have knowledge of quality-based resources and strive to stay current as resources change or are replaced with new resources. The fourth competency involves understanding the principles of evaluating consumer health information for quality. Librarians must apply quality criteria when selecting items for the print or electronic collection. Librarians must have the ability to critically examine and filter materials from web-based and other resources when choosing an appropriate resource for a particular patron. Librarians must provide users with evaluation criteria and guidance for finding appropriate health materials. For the fifth competency, librarians must know and apply effective communication techniques. Librarians must understand and apply the additional components of health reference interviewing. Librarians must be able to recognize and take advantage of teachable moments with patrons. Effectively teach users how to use search engines, library catalogs and subscription databases, reference materials, and online resources. For the sixth competency, librarians must understand the related issues of literacy and health literacy, and the principles and practices of serving users with low literacy skills or low health literacy, including knowledge of understandable and appropriate print, online, and multimedia health materials. Librarians must be able to gauge the readability of a resource and be aware of signs of low literacy in patrons. Recognize that low health literacy can affect anyone regardless of education or socioeconomic levels. The seventh competency requires librarians to understand current technology used by patrons within and outside of the library, have proficiency assisting users with library computers, the library catalog, subscription-based health information resources, internet search, and web-based health resources. Librarians must be aware of emerging technology trends in health-related social networking, mobile access, electronic health records, and personal health records. And the eighth competency involves understanding ethical issues surrounding the provision of medical information, including the use of discretion and the patron's needs and right to privacy. Librarians must know and apply the library's policy regarding the use of disclaimers when providing medical information. Librarians must provide recommendations for health information resources only. Never provide medical advice. Understand the limitations of the librarian's role, and always recommend that the user discusses the information received with a health professional. Here in the Philippines, there is no certificate training offered for medical librarians, even more so for consumer health librarians. Only UP SLIS offers electives for medical and health librarianship, but students are not required to take them. The Medical and Health Librarians Association of the Philippines, or MALAP, provides venues for medical librarians to share best practices and expertise. MALAP also provides training and upskilling for medical and health librarians to keep up with the trends and be able to serve their communities better. Here in the Philippines, most librarians have dual or multiple roles, serving the students, faculty, and or the general public with library needs, while also assisting these patrons with specific consumer health information needs. The key to quality consumer health information service is agreement between the librarians and the library administration on the parameters of services to be offered. Each service have to be highly individualized to the needs, community, and policies of each institution. Is the librarian comfortable with agreeing to be available for all health information questions, regardless of patron purpose or level of need? Do the librarians have the necessary training to serve in that capacity? So what can we do to provide health information responsibly? Librarians are always expected to provide assistance in finding information, no matter what type it is. So first, help refine information requests. Recognize or expect complex questions. It is not always a simple directional questions. Expect follow-up questions. Remember not to give personal medical advice and do not interpret information for them. Refer them to professionals and keep personal opinions to ourselves. Then, we need to know what resources are available. Are these authoritative? Are they from reliable sources? We should always bear in mind that we need to have good information to counter bad information. Here are questions to ask when picking a resource. Is the information appropriate for the user? Can the person understand the information? Does the information answer the user's questions? Is the information accessible? And lastly, we must be able to know our professional boundaries. We should be able to direct our users to health professionals. We must be cautious in offering health information related to symptoms and treatment options. There's a very thin line in providing health information sources and giving personal medical advice. And we should always keep information confidential. Be compassionate and considerate to your users. Offer confidential support. Prepare appropriate materials based on who is asking.
Now let's discuss different scenarios and some reference tips. Scenario number 1. The security guard in your school approaches the medical librarian to inquire about the dosage of paracetamol for his 5-year-old son. He knows that for adults, he should take 1 tablet every 4 to 6 hours. Question: what should you do in this situation? Dapat mo bang sagutin kung ilang dosage ang dapat ibigay sa kanyang anak? What kind of evidence should you use to answer this question? My recommendation is to refer them to the information source only and refer them to medical professionals. In this case, pwede mong sabihin na may gamot na mabibili over the counter or yung tinatawag na non-prescription drugs. Usually, sa karton or sa container, may leaflet na kasama. Dito, may information tungkol sa tamang dosage based sa age or edad ng bata. Pwede mo ring sabihing mag-search sa internet, particularly sa memes.com/Philippines para sa mas detalyadong impormasyon. At pinaka-importante, sabihin mo na kumonsulta sa doktor dahil bukod sa edad, isang factor sa pag-calculate ng dosage ay ang bigat or weight ng bata. Remember, do not give personal medical advice. Iwasang magkwento kung ano ang bumana o nakapagpagaling sa'yo o sa anak mo. Scenario number 2. In scenario number 2, you notice that one of the students seems uneasy and always looking down and stressed. He sits and reads alone for the past couple of weeks. He avoids eye contact and he never asks for help. One day, when you're shutting down the computer that he used for the whole afternoon, you notice that he was looking at information about antiretroviral drugs and you're aware that these are for HIV. Question: will you initiate and prepare information for him? Will you suggest or list down websites or subscribe databases where he can find more credible information? My recommendation is to use discretion and respect the student's right to privacy. I will keep it in mind that he might need the information someday, but I will not insist or initiate giving it to him. Kung meron pa po kayong ibang katanungan or similar experience na gustong i-share, pwede po kayong mag-comment or mag-email pagkatapos ng lecture. Before we close, let's have a post-assessment first. Choose the letter of the correct answer. You are given 10 seconds to answer each question. For question number 1, what is defined as the personal characteristics and social resources needed for individuals and communities to access, understand, embrace, and use information and services to make decisions about health? A. Social media literacy. B. Health literacy. C. Information literacy. Or D. Digital literacy. The answer is B. Health literacy. Number 2.
What is the information written by and for medical professionals? A. Consumer health information. B. Clinical information. C. Digital information. Or D. Political information. The answer is B. Clinical information. Number 3. Which of the 8 competencies involves being well-versed in library subscription databases, including the coverage of materials, currency, and appropriateness for specific requests? Is it A. Knowledge of the community? B. Knowledge of the health consumer? C. Knowledge of the subject matter and resources? Or D. Ethical and legal issues? The correct answer is C. Knowledge of the subject matter and resources. Number 4. Consumer health librarians can be found in these institutions. A. Hospital libraries. B. Academic libraries. C. Patient resource centers. Or D. All of the above. The correct answer is D. All of the above. Number 5. Which of the following statements is correct? A. Provide recommendations for health information resources only. Never provide medical advice. B. Understand the limitations of the librarian's role and always recommend that the user discusses the information received with the health professional. C. Keep information confidential. Or D. All of the above. The correct answer is D. All of the above. Did you get all the answers correctly? Yes, of course.
Maraming salamat po sa inyong pakikilahok at pakikinig. You might be wondering, meron bang consumer health library dito sa Pilipinas? Kung ang hinahanap po natin ay isang medical library para sa general public or mga pasyente, wala po. Nagtanong po ako sa National Library of the Philippines, pero wala daw po silang medical and health collection. Kung meron pong magtatanong tungkol sa medical information, nire-refer daw po nila ito sa mga medical schools or ibang medical libraries malapit sa kanila. Sa DOH Library naman po, kailangan muna ng referral letter bago kayo tanggapin. Karamihan po ng kanilang library visitors ay mga staff ng DOH, mga doktor, medical, or nursing students. Nagtanong po ako sa mga ibang medical libraries pero hindi rin po sila tumatanggap ng general public. Nagtanong din po ako sa mga ibang hospital librarians pero unfortunately, hindi rin po sila tumatanggap ng pasyente. Kung sakali man pong may pasyente, ito daw po ay kasama ng mga doktor at ang doktor nila ang humihingi ng information para sa mga pasyente. Yung iba namang pong mga research libraries ng mga pharmaceutical companies, ang library privilege ay para lang po sa kanilang mga staff. Kung meron pong mga katanungan tungkol sa medical information, maganda pong sumangguni sa mga miyembro ng Medical and Health Librarians of the Philippines or MALAP. Muli po, maraming salamat sa inyong pakikinig. Atin pong tandaan, huwag po tayong mahihiyang magtanong kung may right med information ba dito. Because librarians know, information is the best medicine for healthcare questions.
Thank you so much, Miss Jonah. Nakakabay yung Who Wants to Be a Millionaire towards the end, no? But your talk is very relevant to what we're experiencing right now here in the Philippines. To our viewers, if you have questions for our speaker, you can go to menti.com and key in the code 2555903. You could also use the QR code shown on the screen to go to our questions page. Please check the previously posted questions and vote questions you would like to be prioritized. I can see that we're already receiving some questions from our viewers. But before we go to them, let me just announce a few things. UP SLIS is hosting the 41st Gabriel A. Bernardo Memorial Lecture on March 17th, entitled Informed Societies, Responsible Citizenry, the Role of Libraries in a Democratic Society. This is held in celebration of the legacy of Gabriel A. Bernardo, Doyen of the Philippine Librarianship. This is the longest running lecture series related to LIS and has been the venue for the discussion of relevant library and information science issues and trends. This year's lecture is to be delivered by Dr. Maureen Henninger. She was in the forefront of research and practice in the digital environment, and specifically with the advent of the internet, published and consulted widely on digital literacy for industry, government, and non government organizations, both in Australia and internationally, and has been an invited guest speaker at many conferences within the information, medical, biotechnology, and education professions. Her current concern is the governmental mechanisms and practices that enable and constrain democratic process and active citizenship. This event is open to all. You're invited to register at bit.ly/Gab 2021. That's bit.ly Gab 2021. To be able to receive email updates and submit questions a couple of days before the event, the lecture itself will be streamed live through our YouTube channel and Facebook page. Students of UP SLIS are also invited to our second semester's Kapihan on March 10, Wednesday, starting at 2 p.m. Please attend so you can raise your concerns with our full-time faculty members. This SEM's Kapihan will be broadcasted live via UP SLIS Facebook page. The latest issue of the Philippine Journal of Librarianship and Information Studies, with the editorial entitled New Agenda for the New Normal, is now available. You may download a free copy of the PHJLIS by going to phjlis.org. You may also submit your articles by logging into the same website, or if you have any inquiries, you may send it to editor@phjlis.org. Please also check out the article, Health Literacy Education and Research in the Philippines, an agenda for Filipino information professionals during and after COVID-19. This article is by John Robert Bautista of the University of Texas at Austin School of Information. This article is published at the PHJLIS. Check it out by going to phjlis.org. We would also like to thank those who already purchased our SLIS coffee table book. For those of you who haven't got your copies, you can now pre-order for our next print run by going to bit.ly/SLISCTB. That's bit.ly/SLISCTB. For those of you who have fond memories of UPSLIS, we also want to know your best, funniest, weirdest, oddest, scariest, sappiest memories in SLIS through a project called #I Remember. So if you have something that you want to share, please go to upslis.info/I Remember. And also, the UP SLIS is still accepting donations for the construction and renovation of our new SLIS building. For your donations or inquiries, you may contact us via email at admin@slis.upd.edu.ph. That's admin@slis.upd.edu.ph. We'd also like to thank Ma'am Vanj for the alumni video earlier. Ma'am Vanj graduated from UP SLIS in 1993. Maraming salamat po. And finally, to ensure that every BLIS student is equipped with the required tools or gadgets for remote learning, the Kaagapay project for UP BLIS students of the UP Library Science Alumni Association or UP LSAA is still ongoing. This is in support of the program of the UP system, Kaagapay sa pag-aaral ng mga scholar ng bayan. You may donate in cash or in kind to help our BLIS students who may be struggling with remote learning. You may also send your inquiries to uplsaa.inc@gmail.com. Okay? Please subscribe to our YouTube channel and like our Facebook page, UPSLIS, where this video is currently being streamed. That's UPSLIS on YouTube and Facebook. We'd also like to give a shout out to our viewers from Quezon City and the San Sebastian College, Recoletos, Manila. Hello. At this point, I believe we have more questions from our viewers. Ma'am Jonah, are you ready?
Okay.
Okay, so let's now address some of the questions. I see here a question that is very relevant. So let's start with this one. What advice can you give to those who are afraid to get vaccinated?
Um, hmm. Sasabihin ko sana kasi, pwede silang mag-consult sa mga clinical trials information, pero medyo technical kasi yung explanation dun. So, baka hindi rin nila masyadong ma-appreciate yung data. So, mas maganda kung, syempre, as yung parating sinasabi during the lecture is to consult your doctors. Kasi they know best kung ano yung mas maganda. So, kumbaga, sila na yung nagbasa for us para mas maintindihan natin as laypersons. Pwede kong sabihin na mag-consult kayo sa Cochrane, magbasa kayo ng mga systematic reviews, mag-check kayo sa clinicaltrials.gov. Pero, kung yun, challenge yung pag-appreciate ng masyadong maraming data about it. Especially now na hindi pa kumpleto yung data about the vaccines. So, vaccines are generally safe. Napag-aralan na yan ng mga eksperto. Pero as to the COVID-19, parang ano pa lang trial phase pa rin tayo. So, it's generally safe. But, hindi natin maiiwasan yung mga adverse effects. So, kung gusto niyo magbasa-basa, yun yung mga pwede niyong puntahan na resources. Cochrane, clinicaltrials.gov, and of course, best to consult your doctors kasi kaya na nila yung i-summarize for us.
Ayun, maraming salamat po, Ma'am Jonah. Tama nga naman, let's always consult our doctors, especially kung medyo highly technical yung mga data about the vaccines. We also have another question here. You mentioned earlier po no, in your lecture na wala pa talaga dito sa Pilipinas na um, public library for that is dedicated for medical information. So, what the question here is, what are your tips if you want to establish a consumer health information service in a public library setting?
So, nabanggit din kayo na sa lecture na magiging successful yung initiative na to kung merong agreement between the admin and the librarian. Kasi kailangan yung pag-usapan up to what extent yung services na pwede ninyong ibigay. Kasi based sa experience ko as a medical librarian, once you put up service for medical practitioners, iba kasi yung culture nila eh. Gusto nila pag kailangan ko ngayon nandyan na. So, handa ba tayo para sa mga ganong situation na kapag kinailangan nila, laging may sense of urgency. Because compared sa ibang libraries, academic libraries, public libraries, yung kinikater na audience or patrons ng medical libraries handles life. So yung sense of urgency nila parating nandun. So minsan kahit weekend or past office hours, yung mga doktor, feeling nila, doktor ka din na on call anytime. So handa ba tayo doon? So yun yung number 1. Number 2, handa ba tayong i-provide yung mga medical resources? Kaya ba natin gawin siyang accessible for our users? Kasi number 1, mahal yung mga subscription. Habang mas nagiging specialized yung ating collection, mas nagiging mahal siya. Parang kunwari sa mga textbook. So kung textbook siya, mas mura siya compare dun sa mga special books na nilalagay natin sa reserve section. So mas expensive ang subscription to medical resources, to credible medical resources. So yun yung kasunod na kailangan nating paghandaan. So number 1, yung agreement between the administrators. Number 2, yung resources, kaya ba natin paglaanan ng budget? And siguro number 3 is, equipped ba tayo or handa ba tayong librarian to provide that service? Kasi kung wari, may manghingi ng information about it, as I've said kanina, yung sense of urgency nila, kung bago tayo dun sa information na yon, kaya ba nating i-translate from clinical information made for medical practitioners to consumer health information na pang-lay? Or basta-basta na lang ba natin, ay nakuha ko, na-download ko tong article na to from this resource, ibibigay mo diretso dun sa client mo. Hindi nila maiintindihan kung wala tayong konting annotation about it. So, kailangan natin i-equip yung sarili natin for that. So, yun siguro yung kailangan nating paghandaan or upuan natin yung admin natin kung gusto nating mag-provide ng consumer health information or kahit health information na lang sa ating mga libraries. Yung resources, yung skills, madali na lang yun tayo pang mga librarian. Kayang-kaya natin yan. Mas madali tayong mag-adapt. Pero yung resources, especially kasi kung medical and health yung topic, hindi tayo basta-basta pwedeng kumuha na lang from somewhere. Kasi, yun nga, may buhay yung nakasalalay ko. So, yun. Thank you.
I see. Maraming salamat, Ma'am Jonah, for that very comprehensive answer. No? So aside from the resources, there are also a lot of skills considerations to really establish medical library that is geared towards the general public. In relation to that, actually biglang nagdatingan yung mga questions, Ma'am Jonah. I think our audience, our viewers are really interested with this topic. No, there's a question here. If I gave the wrong or inappropriate health information to a library user by mistake, will I be held liable if something bad happened to the said library user because of what I did? So, as you mentioned earlier po, no, sometimes this can be life and death situation. So, ano po kaya yung possible na mangyari kung nagkamali ang isang medical librarian?
Unang-una, kanina dun during the lecture, parang binigyan tayo ng, sort of warning na never to give medical advice. So, mas mag-focus lang tayo dun sa information na ito yung nakuha kong information, pero best na ipa-interpret siya sa medical professionals. So, I think, kung maging careful tayo pagdating doon, kasi dun sa mga literature na nabasa ko when I was preparing this lecture, sinabi doon na kung directly involved yung treatment doon sa information na hinihingi ng user, wag nating ibigay. Kasi baka nga gawin nila. Hindi naman tayo medical professionals. At baka magkaroon sila ng misrepresentation na parang ay galing sa professional librarian yung information na to, baka tama at pwede kong gawin. So, mas maganda na kung para tayo nagpre-prepare ng RRL, So bibigay natin yung mga pros and cons. Huwag yung may diretsong sagot dun sa tanong nila kung treatment or cure yung nature ng question. Yun yung maging careful tayo kasi although pwedeng hindi tayo maging liable or talagang as in makasuhan or magpunta sa korte, pero yung konsensya mo na may mangyari hindi maganda dun sa person because of the information you gave at nakalimutan mong ibigay or i-recommend na kumonsulta sa doktor at nakalimutan mong magsabi na information lang po ito, hindi po dapat ito pina-follow ng walang consultation sa medical practitioner. So kung na-skip natin yung proseso na yon, yung konsensya natin, di ba mabigat sa kalooban kung may mangyari. So yung question kung magiging liable pag nagkabigay ka ng maling information, I'm not sure kung hanggang saan yung extent ng law, pero yung konsensya mo na lang siguro. So yun yung maging very, very careful tayo about giving personal or medical advice.
I see. Maraming salamat po. I think you really emphasize it during your presentation that there is really a line between giving personal advice and providing information. Ma'am Jonah, I'm just curious, in your experience po ba, naging mahirap po ba mag-delineate between that line? Di po ba minsan parang hindi natin sure kung advice na pala yung nabibigay natin or nagpo-provide lang ba tayo ng information? Ano po yung experience niyo sa pagbibigay ng advice and ng information?
Dahil nasa isang medical institution, sa medical school sa amin sa Ateneo, parang hindi na masyadong kailangan i-explain or expound because of most of our clients are students, doctors, faculty, at mas maalam pa sila kaysa sa akin tungkol sa medical practice. Pero paminsan may mga nagtatanong, yung mga cleaners natin, mga maintenance officers, security personnel. So, yun, kailangan natin sabihin sa kanila na hindi sakop ng ating responsibility yung pagbibigay ng advice. So, pwede tayong magbigay ng mga resources. So, bigla ko naisip kasi yung pag-delineate. So, paminsan dahil feeling natin expert na tayong maghanap ng information, minsan nagsi-self-medicate tayo. Parang, alam ko, dito ko titingnan kung tama ba or mali yung medication, yung dosage. So, pupuntahan ko yung information tapos hindi na ako magko-consult sa doktor. So, mas sa ating librarians yung mahirap i-delineate kesa doon sa users natin. So, sa atin, for ourselves, sa practice natin, dahil alam natin, mas maalam tayong mag-scrutinize ng resources, mag-critically appraise ng resources, kung sila ba ay credible and authoritative. Minsan, ito galing sa authoritative na author, ito current naman yung information. Hindi na ako mag-consult sa doktor. Susundin ko na lang yung nakasulat dito. So, mas more on doon sa personal na practice, sa experience ko. Kasi yung mga clients namin, as I've said, are medical students, clinical practitioners, doctors, faculties.
I see. Thank you for that. One of the many perks of being a medical librarian, di ba? And I'm sure for not so serious medical conditions, di ba? Pwede naman din yan. Ma'am Jonah, there's a question here about, I believe this came from students who want to pursue pre-med. So the question is, UP-SLIS offers an elective for health science librarianship. What is your advice for students who are continuing this elective as their pre-med? What are the pros and cons?
Okay.
I think the question is this enough for them to survive the med school, having the UP-SLIS medical librarianship as elective?
I think depende yon sa student. kung hanggang saan yung kaya ng pagsusunog ng kilay. number one advantageous na magkaroon siya ng background na pagiging adept sa health information literacy. Kasi nakikita ko sa ibang mga students namin ngayon, nahihirapan sila kapag kakailangan na nilang maghanap ng evidence para sa sa evidence healthcare practice. So, nahihirapan silang maghanap because hindi sila sanay. So, yun yung isang advantage ng medical librarianship, pagkuha ng medical librarianship elective. Kasi yung familiarization mo with the terms, with the types of researches, yung mga cohort studies, mga ganon. So yung exposure sa mga ganong types ng information is advantageous. And now, I think lahat na ng undergrad can be pre-med. Pagpasok mo sa medicine, as long as you pass the NMAT. So, kailangan pa rin heavy on the sciences because may NMAT. Tapos, kung may mga ibang courses or subjects naman na hindi mo na-take during your undergrad, like, I can't speak for the other medical schools, no? Pero sa Ateneo School of Medicine and Public Health, meron kaming parang bridging program na kung meron kang hindi nakuha during your undergrad, you can take it before entering med school. So may mga ganong options. So I think nasa student yan kung magsusurvive sila. Kasi number one, kung nandun yung interest mo and yung puso mo, walang mahirap para sa'yo. So kakayanin mo yung med school. Kasi meron ka ng baon, meron ka ng kaalaman kung paano mag-search ng information.
Ayun, maraming salamat Ma'am Jonah. From the sound of it, I can see na advantageous talaga no, if they really take the medical librarianship electives kasi nga as you mentioned exposure to the literature, I think that's also a very advantageous for students of medicine. We have another question here Ma'am Jonah. I believe this is still related dun sa question kanina about establishing consumer health information service. Okay lang ba? Pwede ba sila mag-establish ng consumer health information service in their own library even if they are not a medical library?
At oo naman, yes, of course. Kasi tayo mga librarian, kaya nating mag-adopt to any situation. As long as mabigyan tayo ng opportunity, mabigyan tayo ng resources, kayang-kaya natin yan. So, yun nga, number one, yung resources ba, meron ba tayong budget to subscribe to these resources? Or kung hindi man tayo makakasubscribe, siguro join tayo ng networks. May mga networks na may mga advocacies and sharing resources and expertise na kung hindi kayang i-provide or limited lang yung kayang i-provide ng ating institutions, kung wari merong request from your users, wala kayo kasi limited lang yung budget nyo. So isa lang yung na-subscribe nyo na database. Pwede kayong mag-request sa ibang libraries na ka-member ng network. So kayang-kaya kung may initiative, may interest, may puso, ayan, at may access sa resource.
Ayun, maraming salamat. Ma'am Jonah, we still have a few more questions here. The next question that was upvoted by our viewers, no, medyo interested na talaga sila to pursue health librarianship. Any hints for health science librarian salary in our country?
Well, dali. Nahirapan ako sagutin for a while. Sinishare ko yan sa class ko before para maengganyo yung mga estudyante ko na mag-shift, Isa sa medyo pero medyo lucrative na salary is yung specialization ng medical and health librarianship. Ang downside lang is because nga medyo maganda yung ang tawag dito, yung offers, benefits, salaries and benefits, bihirang magkaroon ng opening. So yun yung isang sign na okay yung salaries and benefits ng medical librarianship. Kasi sobrang bihira ka makakita ng job postings or job opportunities announcements. Kasi unang-una, nandyan yung mga research laboratories, mga pharmaceutical companies, mga medical schools. So, yun. So, nasagot ko ba yung tanong?
I'm sure nagkaroon na ng idea yung mga students that it is a very competitive field, but the benefits are really good. So, yun. Just a hint to our students. Meron pa pong few questions here that are about, I think these are an issue in about doctors speaking in social media. Merong question dito. Ma'am, what are your thoughts on Doc Adam and his detractors? Familiar po ba kayo dito, Ma'am Jonah?
Mm-mm. Detractors ni Doc Adam. So,
Yes po.
yung ang question ay ano ang
Medyo broad yung question eh. Ano po yung thoughts ninyo on Doc Adam and his detractors?
Ang hirap. Ang hirap naman nung
Ayun nga po. I think it's about the last issue that he had about, is it about the copper mask or... Siguro doon sa viewer natin, you can further expound your question. Feel free to further expound your question. Antayin namin yan. Pero pinapanood niyo po ba si Doc Adam?
Well, familiar ako sa kanya kasi medyo naging controversial siya before because ni-refute niya yung isang, anong pangalan ng doctor na doctor na hindi naman medical doctor na nag-proliferate ng cure about cancer. Ano yung pangalan niya? So anyway, ni-refute niya anong pangalan ng doctor na girl. Si Doc Adam kasi is isa sa advocacy niya is to correct medical misinformation. So yun yung kanyang ginagamit niya na platform ang social media to correct to correct misinformation. So ang ginagawa niya, nagrepresent siya ng data, pero as I've said, 'di ba, para pa rin yung RRL na merong mga for and against na mga research articles, and up to us to judge or to read it or appraise yung resource kung saan ba tayo mas maniniwala. So I think yun yung isa sa advocacy ni Doc Adam. Pinipresent niya yung mga information as a medical doctor. Tapos up to us kung maniniwala tayo. Pwede rin naman kasi natin i-double check yung mga information na binibigay niya and do our own research.
Okay, maraming salamat po. The next question is also about another doctor, I believe popular in social media. How can we correct, ito po yung question, how can we correct questionable beliefs like the cabbage wrap of Doc Farah? Are you familiar with this?
Yes, si Doc Farah. Yun yung naging controversial issue ni Doc Adam kasi na-take down yata yung kanyang site because yung mga followers ni Doc Farah ay nireport siya dahil kinorekt niya yung mga misinformation ni Doc Farah. So, sabi kanina sa lecture, to counter bad information, you need good information. So, ayun, bilang librarians, bilang information professionals, so gawin natin yung sarili nating research. Mahirap kasi ngayon, sa panahon ngayon, dahil nandiyan na yung internet, anybody can just look up any terms. Madali nang magsabi kung yes or no or tama or mali yung isang information. So, pero mahirap gawin is yung pag-convince. So, paano mo mako-convince yung isang user? Presentan mo ng napakaraming research. Presentan mo ng napakaraming information for and against. Tapos, bahala na siyang mag-isip for his own. Pero, I believe, responsibility natin na ibigay yung tama. So, bago natin i-share, i-screen na muna natin yung mga information. So, yun.
Ayun. And that is a really big responsibility. Kaya naman napakaganda talaga ng role ng mga medical librarians. Ma'am Jonah, we have our final question here, and I think this is a really interesting question. Can we provide health information about traditional, alternative, or folk medicine?
What do you mean give? As in, ibibigay lang natin yung mga articles about it, or nagbibigay as in recommending the information na yun yung gawin nila?
Hindi po na-expound but I believe the question is about providing, is this included sa tinatawag nating health literature? Do we also include the traditional, alternative, and folk medicine?
So I guess, so i-assume ko na lang ngayong question is about kung wari merong user na lumapit sa'yo at naghahanap ng options or treatment options para sa isang condition. So, ang question siguro is kung isasama mo ba sa ibibigay mong information yung traditional medicine.
Yes.
Siguro. So, assume ko na lang na yun. Ako, for me, oo, ibibigay ko. Kasi, ayan, teka lang, naisip ko na naman baka magbigay ako ng personal advice. Pero anyway, kasi nga, yung question lang naman is kung ibibigay mo yung information, tapos mag-disclaimer ka na lang na consult your doctor pa rin. Meron kasing mga doctor rin naman or medical practitioners na advocates ng traditional medicine. So, mga acupuncture, ganyan, healthy diet. So, meron na ngayon mga whole body approach, spiritual, mental, and physical well-being ng patient. So, kung naghahanap siya ng information sources, I think it's our duty na ibigay lahat ng information out there na kaya nating ibigay, na sa tingin natin, na screen natin na tama. Pero wag natin pa rin kalimutan na i-advise sila to consult a medical practitioner. Kasi yung pwede nating ibigay is parang general information lang or background lang about the condition siguro kung nagtatanong siya about it and treatment options. Pero mas maganda na mag-consult pa rin sila sa doktor. Parang in a way, nakakatulong tayo because kesa maghanap sila sa Wikipedia or sa internet, sa atin na sila nagtanong. So, meron ng konting screening and critical appraisal on our end. Pero wag natin pa rin kalimutan na sa i-recommend to consult the doctor. So yes, kung merong magtatanong, ibibigay ko or isasama ko yung information about traditional medicine.
I see. Maraming salamat po. No? Yes, tama din naman po. No? As, it's like we already provide them the service of filtering all the other noise out there and na-appraise pa. So that's a really valuable addition to the resources. Ma'am Jonah, we thank you very much for answering our viewers' questions. Medyo madami yung questions ng ating mga viewers. At this point, we will now proceed with the awarding of the Certificate of Appreciation to our speaker. Let me get the certificate. Ito po. The certificate reads, the University of the Philippines School of Library and Information Studies presents this certificate of appreciation to Joenabie E Arevalo, RLMLIS, for delivering her valuable webinar entitled Consumer Health Information Service, Responsible Dissemination of Health Information in Libraries, as part of the 2020 UP School of Library and Information Studies lecture series in celebration of its 59th anniversary, given this third day of March 2021 at the University of the Philippines Diliman, Quezon City. Signed, Rhea Rowena U. Apolinario, SLIS faculty and head of the SLIS Road to 60 Committee, and signed by Mary Grace P. Golfo Barcelona, SLIS Dean. So, Ma'am Jonah, here is your certificate. Ayan po.
Okay. Here.
Thank
Thank
you.
you. Thank you.
Again, thank you so much, Miss Jonah, and we wish you success in all of your endeavors. To all our viewers, thank you so much for joining us, and I hope you all had meaningful takeaways from this webinar. Thank you too to our SLS faculty for making this event possible. Special shout out to Professor Nathan Isip, Professor Mark Santos, and Professor Dan Dorado for managing the tech side of this event, and to Professor Johan Frederick Cabab and Mr. Dridge Paul Reyes for their work on the graphics and publicity materials. To receive your certificates, please don't forget to register using the link to be shown on the screen. And if you miss portions of this webinar, you may rewatch it as a Facebook video or check our YouTube channel. For updates on our upcoming activities, please follow us at our official Facebook page, UPSLIS. Subscribe to our YouTube channel, youtube.com/UPSLIS, or visit our website. It's slis.upd.edu.ph. You can also catch our online talk shows on YouTube. For the Record, Faculty Room, and Student Produced Digital Scholarship Series, and the latest Coffee Break Reflections and Conversations. If you like our videos on social media, don't hesitate to share it to your social network. Not only that, but we're also prepping for more upcoming activities, so please watch out. These are all part of our journey to the road on the road to 60, looking forward to the 60th anniversary of UP SLIS in July 2021. Please join us for another installment of our hashtag Webinar Wednesday series this coming April 2021. Our next feature is entitled Clinical Librarians as Essential Partners of Health Frontliners, with our very own Professor Mark Anthony Santos as our speaker. This will be on April 2021 at 2 p.m. Philippine Standard Time. And that wraps up our UPSLS webinar for this month. Once again, this is Paul Jason Perez, your host and moderator, wishing you all the best. See you on our next webinar. Bye.